A January 2021 randomized controlled trial shows efficacy for the ketogenic diet with PCOS. Find out all the details here today on Jimmy Rants. JimmyRants.com is the website, and as always, you can engage live in the content. Come follow me. I'm right here over on Instagram. Go follow Jimmy Rants over on Instagram. Really easy to find. We do go live Monday through Friday, 11 a.m. Eastern Time, so thank you so much for being here today. We also simulcast live over on my Facebook page as well as over on Twitch. If you have not downloaded the Twitch app, be sure to go download it. It's easy to find wherever you get your apps. And then look up Jimmy Moore Rants, and you'll be able to find the show. If all you know what breaks loose and they kick us off of the traditional social media, I will be originating from Twitch. I know I keep saying that lately, but I have a feeling just suddenly there's going to be a huge purge and we suddenly will not be on Instagram anymore. So if that happens, please go either to Twitch, and if I'm not on Twitch, go to jimmyrants.com. We will figure out a way to do this show. Okay, if you missed the live, you can watch it on the replay right here on the Jimmy Rants Instagram page. IGTV is where we house it there. Goes up just as soon as the show is over. We also have a replay over on the Twitch feed. We also put it up over on YouTube. So type in a keyword Jimmy Rants, you will find the show, and finally go to jimmyrants.com and you can see all the past episodes of this show. Today is Livin' La Vida Low Carb show day, and on Tuesdays I do a best of Jimmy Rants. So you guys know I have been doing a whole lot of episodes lately, all about the jab in the arm for 9-1 Divock. So we're going to do officially the longest episode of the Livin' La Vida Low Carb show I've ever done. We've got 6 Jimmy Rants that we're going to play back to back to back to back to back to back. All about the V word, because I just feel like some of this information has not gotten out there and people don't know what's in this V word. They don't know all the ins and outs and intricacies of what this thing is all about. And so I've been dropping some mad information here on Jimmy Rants, and so we're going to air 6 hours of that information on the Livin' La Vida Low Carb show today. So if you know people that are kind of worried about the V word, or they just don't know anything about it, have them go listen to the Livin' La Vida Low Carb show special Jimmy Rants edition today. LLVLC.com is the website, or wherever you listen to podcasts, Apple Podcasts, Spotify, Stitcher, all the usual suspects. Okay, you guys, today I am excited to bring to you a study. You guys know I am all about trying to keep you on the cutting edge when it comes to the research as it comes out. And whether you realize it or not, there's a lot of research that's underway looking at ketogenic diets. I read from an article yesterday from Gary Taubes, who again has written a beautiful book called The Case for Keto. And he noted in his article, the Wall Street Journal article I read yesterday, that there are currently, right now, 100 clinical trials currently looking at a ketogenic diet for some ailment or another. And of course, sometimes people go, well, I don't need a study to show me whatever they're showing in a study. But guys, you don't realize the power of research is this is how things change in medicine. This is how you open the eyes of practitioners, and it becomes, and it trickles down ostensibly down to the doctor level that's treating patients. And so, yes, you know, keto does this, keto does that. That's not the relevance of science, okay? So I hate it. Every time a new research study comes out, we hear a lot of snarky comments from people in the keto world. Well, this is nothing new. Well, right, it's not new, but it's never been codified, or it's not codified enough to make a difference. And so let's support the studies. Let's support the research when it comes out. Let's not make fun of it. Well, we already know that. This is the mistake actually that Dr. Atkins made back when he was first approached by Dr. Eric Westman. I remember Eric telling me this story. This was back in the late 90s. and he went to visit Dr. Atkins's clinic because Eric had several patients come in. Hey, I lost weight doing the Atkins diet. Hey, I lost weight doing the Atkins diet. Hey, my heartburn got better on the Atkins diet. I came off my diabetes medications on an Atkins diet. So he's like, whoa. Like, I need to go, like, examine the guy that's doing this. So he goes to Dr. Atkins's clinic in New York City, and he's like, what you're showing me here is amazing. Like, he shadowed him all day and saw the patients and how they've gotten better. But where's the research? And Dr. Atkins, no lie, said to Eric Westman, this is before Eric did any of the studies, I don't need research with what my two eyes show me is happening in my patients. I don't need studies to prove that. And what Eric understood and what Dr. Atkins did not understand was, yeah, you do. You need the research to have legitimacy. You need research for this to become more well-known and more able to be used clinically speaking. And so this is why when we get new studies, we should be celebrating, we should be putting it out there, we should be supporting this research by, like what I'm doing, talking about it on Jimmy Rants. Share this study on your page. Get it out there. Let people know this is important. We have research, we have science that supports what we're promoting here. And the more science becomes corroborated, the more people go, wow, the preponderance of the evidence is so overwhelming. So today I have a study, and it's one of the better studies, you guys. So you guys know that a study is not a study is not a study, just as a calorie is not a calorie is not a calorie. You have carbs, fat, protein, you name it when it comes to calories. When it comes to studies, you also have similar breakdowns. You've got something called an observational study. This is where you see a whole bunch of these different kinds of research done, and they observe similar effects in all the different studies, and then they extrapolate out of that to make some grand conclusion. That is a horrible, horrible study. You also have animal-based studies. And again, the animal studies is very interesting to show in animals what happens, but last time I checked, I'm not Mighty Mouse, here to come to save the day. And so when they do a mouse study, that is not applicable to humans. If you're going to look at any research that's applicable to humans, you got to look at research that they actually did on humans in a very clinical setting. And that's what I have here today. It's a small study, but it's a study of note. When it's a smaller randomized controlled trial, that's the gold standard. That's the good kind of study. When it's smaller, it's considered a pilot study. So a pilot study is proof of concept with a small group of people so that then we can release this information as the grand hypothesis for testing on a wider scale. So it's in the Journal of Obstetrician and Gynecology, Ketogenic Diet. This is the title of it. Ketogenic Diet in Women with Polycystic Ovary Syndrome and Liver Dysfunction who are obese. A randomized, open-label, parallel group controlled pilot trial. So they explain all those terms here in a minute, so don't worry about that. It looks like it's out of researchers out of China. Let's see, the Beijing Shijian Hospital, the Capital Medical University, and the Dalian Medical University, all out of Beijing and Dalian, China. Okay? All right, so let's read the abstract first. The aim of the study, to evaluate the effects of a ketogenic diet in women with polycystic ovary syndrome, called PCOS, and liver dysfunction who were obese. So what did they do? The methods: women with PCOS and liver dysfunction who are obese were enrolled in this prospective. Prospective means we want to try to see if there's an effect. And so they always do these kinds of studies in smaller groups of individuals so that then if they get good results, they can say, see, we did a pilot study, it worked in this small group of people, give us funding to do the bigger group. Open label parallel group controlled pilot trial. They randomly either went on the ketogenic diet or They went on the conventional pharmacological treatment, which is Essential plus Yasmin in the control group. They did a 1-to-1 ratio for 12 weeks. The primary endpoint was they wanted to look at liver function markers. Remember, they had liver dysfunction. So they wanted to see any changes that would happen in liver function. Secondary endpoints included how the woman's menstrual cycle was, anthropometric characteristics, body composition, hormonal levels, and metabolic biomarkers. So let's quickly look at the results from the abstract. Of the 20 eligible participants who were enrolled in the study, 18 of them completed the study. The ketogenic diet reported, listen to this, a significant reduction in anthropometric characteristics and a significant reduction in body composition from baseline to week 12. In addition, there were significant reductions in the menstrual cycle, plasma estradiol, which is one of those key hormones you ladies deal with, progesterone levels in both groups. No significant between-group difference was observed of all those things. Ketogenic diet significantly reduced the liver function markers compared with the control group. The signs of fatty liver disease, listen to this, disappeared in 6 out of the 7 who had fatty liver, who went on the ketogenic diet. I tell people this all the time. You don't get fatty liver from eating fat. You get fatty liver from eating carbohydrates and fructose and all the things that the liver has to work hard. Did you know that your body has to handle that fructose that you put in there? So I think back all those years, my God, that I drank 16 cans of Coca-Cola a day with high fructose corn syrup in them. It's amazing I never developed fatty liver. But 6 out of the 7 of them got better with ketogenic diet just after 12 weeks, while only 1 of 10 fatty liver participants in the control group saw theirs disappear using the pharmacological approach. Isn't that interesting? So the conclusion of the study, and then we'll get to the full study itself, in addition to improving the menstrual cycle, the ketogenic diet had the additional benefits of reducing blood glucose, which stands to reason. It also reduced body weight, improved liver function, and treated fatty liver compared to the traditional drug treatment for women with PCOS and liver dysfunction who had obesity. So this is an exciting study. By the way, I found this study. A friend of mine that I follow, she goes by Carnivore Shrink here on Instagram. Go look her up. But she posted this on her page, and I went to look it up, and it was behind a firewall where I would have to pay for the study. And so I wrote to her and I said, hey, I would love to address this on Jimmy Rants. Do you have a copy of the study? And she's like, absolutely, here you go. And so she sent it to me. I'm always on the lookout, you guys, for this kind of research, because this is important to know all the health benefits of this way of eating that we all love so much. All right, let's get into the main part of the study. And if you're just joining us, yes, I am reading from yet another study. This one just came out last week, and it's in the Journal of Obstetrician and Gynecology, and it just came out last week. Title of it, Ketogenic Diet in Women with PCOS and Liver Dysfunction Who Are Obese, a randomized open-label parallel group controlled pilot trial. So we're up to the introduction. PCOS is a common endocrine and metabolic disorder that affects at least 5 to 15% of women of reproductive age. It is characterized by hyperandrogenism, menstrual dysfunction, polycystic ovaries, anovulatory infertility, and obesity. Like any woman who has ever experienced PCOS, they will tell you it sucks. And one thing that's never brought up when we talk about PCOS is it is just another manifestation of insulin resistance. You know, you hear me and many other people talk about insulin resistance a lot. PCOS is just another one of those manifestations of insulin resistance, just like type 2 diabetes is. just like Alzheimer's disease is, just like many cancers are, just like heart disease is, just like obesity is, on and on and on. And so all of these diseases that we like to classify as all these different things, they're not really different things. They are literally all insulin resistant. So keep that in mind as we read about why this study found what it found, because it's so important. And the manifestation of PCOS, that big one in that list was the inability to have a baby, the infertility. So many women who have dealt with PCOS have tried to have a baby, and this just makes it difficult. And then they go on a ketogenic diet, they heal the PCOS, and then suddenly they're pregnant. I've seen it so many times. And I've talked to many reproductive endocrinologists who have said the same thing, that they just put them on a keto diet, and within a couple months, there's a baby cooking inside of them. Oral contraceptives are the most common treatment for women with PCOS who don't want to seek pregnancy. Yeah, that's kind of hard if you're trying to have a baby and you have PCOS, but the answer is taking an oral contraceptive. Kind of hampers your ability to produce a baby. Many patients with PCOS present some relative contraindications to the use of oral contraceptives. Previous studies have shown that up to 30% of patients with PCOS have elevated ALT levels, and the prevalence of non-alcoholic fatty liver disease is 42% in a series of patients with PCOS, average age 25. That's amazing, the fatty liver hitting that young. However, there is currently no specific clinical treatment for patients with PCOS and liver dysfunction. Thus, trying to develop a new treatment strategy has become an urgent problem for patients with both PCOS and liver dysfunction. So the ketogenic diet is a high-fat, low-carbohydrate diet. It can lead to a state of nutritional ketosis, which has been shown in plenty of research to treat epilepsy. Evidence has shown that the use of the ketogenic diet has been an alternative or additional therapy for cancer, PCOS, neurological disease, and acne. Many researchers have reported that the ketogenic diet significantly improves body weight, luteinizing hormone to FSH ratio, fasting insulin in patients who have PCOS and obesity. However, the role of the ketogenic diet in patients who both exhibit PCOS and liver dysfunction and are obese remains unclear. Interestingly, evidence has shown that the ketogenic diet is an effective treatment for non-alcoholic fatty liver disease. Of course it is. Like I said, it's another form of insulin resistance, as is fatty liver disease. And so when you're not eating those foods that then have to be processed by the liver, which would then make it fat, remember, it's not the saturated fat you eat that makes a fatty liver, it's the carbs and the fructose that you eat that then have to go to that liver to get processed. And when it's like processed and processed and processed, little more fatty each time, that's how fatty liver disease happens. Think about how they make foie gras. They have to stuff corn into these animals to make their liver fatty. That's literally how they do it. Stuff them with a whole bunch of carbs, and then they put it on a plate as fatty liver, and that's how they make it. This suggests that the ketogenic diet may play an important role in patients with PCOS and liver dysfunction who also happen to be obese. Therefore, we have created a pilot study investigating the effects of the ketogenic diet in women with PCOS and liver dysfunction who are also obese. So let's take a closer look at the study design and the participants. So this is a prospective, randomized, open-label, parallel group controlled pilot trial. It enrolled women with PCOS and liver dysfunction who were obese from July to December back in 2019. The diagnosis of PCOS was based on the revised Rotterdam criteria, where they have to show various signs, and obviously they do. This trial was conducted in accordance with all the practices in China that they call for. The participants' inclusion criteria was as follows. Here's what they were looking for. Participants had to be diagnosed with PCOS. Participants needed to be between the ages of 18 and 50. Remember, they were trying to find women of childbearing age. I know 50 is pushing it because usually over 40, no more, but it's possible all the way to 50. Participants with a BMI of 28 to 32. Participants with liver dysfunction. Participants without fertility requirements within 3 months. The participants excluded were participants who had a history of excessive drinking, because that would be a confounding variable, because there is this thing called alcoholic fatty liver disease. You always hear about non-alcoholic. Well, the reason they make the distinction is if you drink a lot of alcohol, you can make your liver pretty fatty as well doing that. If you have a history of drug abuse, they also excluded. If you had a hepatic tumor, hepatic cirrhosis, viral hepatitis, or acute hepatitis, and if the women were already pregnant or lactating. All right, so let's get into the intervention itself. All eligible subjects were randomly assigned to a ketogenic diet group or a control group. And so they used a 1-to-1 ratio by the random number created by a computer. The ketogenic diet in the present study, listen to this. This is the makeup of the ketogenic diet. 5 to 10% of the energy, calories, came from carbs. No more than 50 grams a day. 18 to 27% came from protein, and 70 to 75% came from fat. That, you guys, is what's called a well-formulated ketogenic diet. High fat, moderate in the protein, low carbohydrate. That's well formulated. People can call things keto all they want, but when you look at a ketogenic diet from a research standpoint, it needs to be well formulated, and this one is. The daily calories were calculated by a qualified dietitian based on the basic metabolic rate of the women's body composition. It was around 1,300 to 1,500 calories a day. Subsequently, this daily caloric requirement was divided into 3 meal menus, which were provided to participants through mobile phones and updated every 3 days. Foods appropriate for the ketogenic diet included all kinds of oils. I don't like that terminology, all kinds of oils, because we know not all fats are created equal. If it's butter and avocado oil and lard and coconut oil, olive oil, those kinds of things, cool. What about vegetable oils? The seed oils, the canola oils, the soybean oils, and some of the other polyunsaturated fat-rich foods. So I don't like that. All kinds of oils. I wish they were more specific on that. All kinds of meats, things like pork, beef, and fowl, eggs, seafood, and vegetables. Remember, this is China where this is at. Wax gourd. I don't even know what is wax gourd. Is that a squash? I've never heard of wax gourd. Tomato, eggplant. I really have never heard of this. Brassica picanissus. That must be a Chinese food. I've never heard of that. And garlic sprouts. Anybody hungry for all that? Participants were allowed to eat with no limit the wax gourds and the konjac. So the konjac, you might have heard of shirataki noodles, the miracle noodles. I'm not surprised that's in a study from China. And it's basically all fiber and extremely low in carbohydrates. And they contained almost no carbohydrates, the konjac products. During the 12-week intervention, the subjects were contacted by mobile phone to make sure they were compliant and to address any concerns. Compliance with the dietary regimen was monitored, taking daily measurements of urine ketones. So they didn't choose to opt for blood ketones, which is a little more of a gold standard of testing for ketosis. They didn't even take some of the new technology with the breath ketone. They're still peeing on a stick. But if they'd never been keto adapted before and the study was 12 weeks, maybe early on they see presence of ketones, maybe later on they don't. Like, that's a confounding variable to me. if I was doing this study, I definitely would have opted for testing blood ketones and not urine ketones. But they didn't ask Jimmy Moore. The control group received a pharmaceutical drug, polyene phosphatidylcholine, under the name brand Essential, and it's an oral drug for auxiliary improvements for toxic liver damage. It's approved by the China Food and Drug Administration and Pharmacopoeia. After liver function was normal, oral contraceptives like Yasmin, Sharing AG is the pharmaceutical company, were given to help regulate menstruation cycle in those women. All of the participants were required to perform resistance exercise, so they had to lift some weights a few times a week, 15 minutes, 3 times a week, in order to maintain their bone density and their muscle mass. Heavy aerobic exercise was not recommended. So they were trying to keep all the confounding variables out of the picture. And when you're doing a nutritional health study where you're trying to isolate, is it the ketogenic diet giving the benefit? It's good not to bring in these other things. Because people are like, well, they could have got more benefit had they, and then you add in some stimulus. But think about it. When you're trying to isolate what it is that's causing the effect, if it's a good or bad effect, you want to know exactly what it was that did the effect. And so they isolated ketogenic diet, and having them do 15 minutes of weightlifting 3 times a week is just to maintain bone density and muscle mass. That doesn't really confound it too much. A little bit, but not too much. Whereas having aerobic exercise certainly would. All right, so let's look at the outcome measures. All subjects underwent a detailed anthropometric measurement, so they measured body weight, height, and BMI. Body composition analysis, so they got to see their bone density, got to see how much fat mass they had and how much lean muscle mass they had. Blood tests, liver function markers, hormonal levels, and metabolic biomarkers, as well as an ultrasonography, which does liver ultrasound and pelvic ultrasound at baseline. They then did it again 1 month later at week 4, and then they did it again at the end of the study at week 12. The primary endpoint they were looking for was liver function markers. Remember, these are women with PCOS, with liver dysfunction, who are obese. So their primary thing they were looking for, can we improve their liver markers? Okay. Secondary endpoints included, did the menstrual cycle improve? So you ladies who have menstrual cycles, which is all of you, if you're of that age of this study group, you're going to say, hey, yeah, sometimes the cycle can be a lot more painful. Sometimes it lasts a lot longer. Sometimes the flow is worse. Like all of those things they wanted to take a look at as a secondary marker. Anthropometric measurements, endocrine biomarkers, and metabolic biomarkers. So body weight was measured on the same scale. The subject wore the same light clothing with shoes and socks removed. Height was measured using a stadiometer. Body composition, such as body fat percentage, visceral fat, waist to hip ratio, all of that was analyzed by a bioimpedance analyzer. If you've never had a bioimpedance scale, they're pretty cool. Tanata, T-A-N-A-T-A, is the big name brand if you want to get one of those. But you step on the scale, and it not only gives you your body weight, but then it breaks down how much water composition do you have in your body. It shoots this little bioimpedance signal through your body, and it can measure that. It also can measure what your body fat percentage is. So it's pretty cool technology. They're not cheap, by the way, those scales. If you go to get one, don't get sticker shock when you see hundreds of dollars. This ain't no Walmart scale where it costs you like $19.99. It's going to cost you some money, but it's worth it for the information you get. The menstrual cycle was defined as the number of days from the onset of bleeding in one cycle to the first day of the next. The menstrual cycle of participants at baseline was defined as the average menstrual cycle for 6 months before the intervention. Blood tests were carried out after a 12-hour fast, including follicle-stimulating hormone, that's FSH, luteinizing hormone, LH, estradiol, testosterone, progesterone, prolactin, ALT, AST, total cholesterol, triglycerides, HDL, LDL, and blood glucose. Blood samples used to assess ovarian function, were collected at the same base of each subject's menstrual cycle. Generally, it was on day 3 to 5. Liver ultrasound was performed in all subjects for an assessment of a fatty liver disease. The hepatic fat accumulation grade was calculated as absent with a score of 0, mild with a score of 1, moderate with a score of 2, and severe with a score of 3. This uses a 6-point scoring system based on the echo contrast, liver brightness, deep attenuation, and vascular blurring. So they're basically trying to see how bad is the liver dysfunction. Additionally, they looked at an ultrasound for looking for either 12 or more follicles with 2 to 9 millimeters of diameter, increasing ovarian volume in at least one of the ovaries. So they're looking for any signs of PCOS and liver dysfunction. They're trying to make sure in these people that we're trying to improve the PCOS, improve the liver dysfunction, are they starting at baseline with having disease? And so it's pretty cool that they tested all that. All right, the statistical analysis went through all the qualitative data measures that we always talk about on these studies. So let's just jump to the results. Of the 20 eligible participants enrolled in the pilot study, all of them were randomly assigned to a ketogenic diet or to the control group. A total of 18 participants completed the study. There were 8 people in the ketogenic diet group. So the 2 who dropped out of the 20, the 2 who dropped out were both in the ketogenic group. The control group had 10. The reason for not completing the study was withdrawn consent, unable to do the ketogenic diet because of business travel. That's what both of the people who dropped out. I'm traveling, I can't do it. That's bogus. Just because you travel for business, you can't do keto? Oh, I wish they had called Jimmy Moore, because I could have easily helped them, and any of us in the keto community could have easily helped them. It's so easy when you're traveling. Is it more difficult? Yeah, it is, but it's not impossible. The baseline characteristics of, and by the way, did they not know they business traveled before they signed up for the study? That's just so crazy to me. Did you not know you had a job that had you travel for business before you signed up to be a part of a pilot study? Anyway, the baseline characteristics of included participants were shown in Table 1. The average age of the control group, 29. The average age of the ketogenic diet group, 31. Average weight in kilograms for the control group, 75. 87 for keto, 158 centimeters for the height, 163 for the keto, BMI 33 for the control group. Remember, they're just on pharmacological treatment. The ketogenic diet group was 30. Menstrual cycle, I'm not sure what that means. It says day mean plus SD. I'm not sure what that means. It says 63 for the control group, 72.5 for the ketogenic diet. So that's the breakdown. The 2 treatment groups were generally well balanced when it came to age, height, BMI, and menstrual cycle. All right. In Table 2, so let me find Table 2. Here it is. There were statistically significant reductions in the BMI. So let's take a look at that. So BMI in the control group, they went from 29.82, then after 1 month of being on the drug therapy, 29.64, and by week 12, 29.20. So statistically, they didn't really change that much. Meanwhile, in the ketogenic group, 32.81 was the beginning BMI. After 4 weeks, 30.77, and after 12 weeks, 28.33. So they dropped over 4 kilo, or over 4 kilo. Body fat in the control group, 25.58. After 4 weeks, 25.28. After 12 weeks, 24.85. So going down, but not significantly. In the keto group, body fat went from 35.38, 31.51, 28.57. It dropped by like 7%. That's huge drop in 12 weeks. So big difference in those categories. All right, hormonal levels. After 12 weeks of intervention, the menstrual cycles were significantly shortened in both groups. Remember, the one group was taking a drug that was supposed to help the liver function and some of the other bodily things that cause the fatty liver. There was no statistical significance between the two groups. In addition, there were statistically significant reductions in plasma E and P levels. Blood tests showed that there were no significant within group and between group differences in total cholesterol, triglycerides, HDL, LDL from baseline in both groups. However, there was a significant reduction in glucose observed in the ketogenic diet after 12 weeks. So that's interesting to me because one of the hallmarks of a ketogenic diet when it comes to your lipids, your cholesterol, is we see triglycerides fall like a rock. So the fact that they saw no difference in triglycerides along with HDL, LDL, And remember, HDL is another one. I would have predicted over the pharmacological approach, I would have predicted triglycerides would have dropped significantly below 100. Just after 12 weeks, very easily. And HDL, eating a 70 to 75% fat diet, would easily go up over 50. And we didn't see that in this study. So that's interesting to me. That runs counter to what we've seen in every other research study I've ever seen of a ketogenic diet. So that's interesting. What about liver function markers? We saw basically all the different markers improve. There were statistically significant improvements in ALT and AST in the ketogenic diet group. The plasma ALT and AST of ketogenic diet at 12 weeks was significantly lower than that of the control group, which suggested the superiority of a ketogenic diet over conventional treatment in trying to treat liver function. And again, as we said earlier, when you're not feeding your body all the crap that then the liver has to process, specifically fructose and other carbohydrates, you're not going to have those issues anymore. This is what makes keto so brilliantly healthy. It's what doesn't really get talked about enough in the vilification of red meat and the vilification of saturated fat. We miss that we're not putting these things in our mouth anymore that cause all these problems. And it's why I'm so passionate about keep talking about this on my show, because we need to keep highlighting this. All right, ultrasound evaluation. Before treatment, 8 participants in the control group were found to have bilateral PCO and 1 had unilateral PCO. And 6 participants in the ketogenic diet had bilateral PCO, 2 of them unilateral PCO. After 12 weeks of intervention, the PCOS signs in 1 patient with unilateral disappeared in control group. 2 of them from the bilateral PCO disappeared in the ketogenic diet group. Liver ultrasound results showed that the fatty liver signs only in 1 of 10 participants with fatty liver in the control group disappeared after 12 weeks. However, the signs of fatty liver disappeared in 6 out of 7 of the fatty liver participants after just 12 weeks of the ketogenic diet. That's the take home of this study, by the way. I know they put the focus on PCOS, but they also had liver dysfunction. 7 of the ketogenic diet ladies, they had fatty liver going into this study. And after 12 weeks, the fatty liver's gone. 6 of them? Wow. Like, that's huge, guys. And it's not new. We've seen it in other research, but it's always great to see it codified, especially in a randomized controlled trial, even if it is a smaller pilot study. It's always good to see replication of what you assume happens. Now, if you're a practitioner out there and you're watching this, or you're a nutritionist, or you're somebody who sees people see improvements, this is not a surprise to you either. But isn't it great to see it in a research study? Isn't it great to say, oh my gosh, like, come here, let me show you this study I just heard about. And in that study, 7 of the ketogenic diet group participants have what you have, 7 of them, and 6 of them got better. Powerful, powerful. All right, so let's get to the discussion part of this study. PCOS was a common endocrine and metabolic disorder in premenopausal women. Previous studies have shown that approximately 30% of PCOS participants have elevated ALT levels, and the prevalence of non-alcoholic fatty liver disease around 42%. Ketogenic diet was reported to play an important role in PCOS and in obesity. However, few reports about the effects of this in women. This is keto diet in women with PCOS and liver dysfunction. So we aim to take a look at that. Approximately half of the women with PCOS were more likely to be overweight or obese. A ketogenic diet was regarded as an effective regimen for weight loss because of the ability of ketone bodies to suppress appetite and allow a very small calorie intake. Okay, let me correct that one. I know these Chinese researchers are trying to be politically correct. I hate that they feel like they have to throw in there, it allows them to eat less calories. That's not why a ketogenic diet works. Yes, in this study, they kept calories around 1,300 to 1,500. I think that's kind of low. And I think they probably could thrive, women especially, and it's a case-by-case basis, but women don't need to be eating low calorie. If anything, they need to be having a little more calories so their body gets used to using that energy. I think for women, 1,600 to 1,800 is a bare minimum calories. So maybe they could have seen similar results that they found in this study, bumping up the calories. I don't know what their hunger levels were like. They weren't really measuring that. They didn't really talk about their state of mind. They didn't talk about how they feel, energy. None of that was in this study. But bump up the calories just a little more, and it would be interesting to see. But they have to throw in that, oh, it lets them eat less calories. A ketogenic diet was regarded as an effective regimen for weight loss. In the present study, we observed similar weight loss effects of keto in women with PCOS and liver dysfunction who are obese. However, no weight loss was found in the control group. Well, duh, they didn't really change their diet. And we know weight loss is predicated not just on trying to heal the liver and some of the other markers. Pharmacological answers are not the way to produce health. That's the take-home message of this study as well. If you ever think health comes in a pill, oh, I'll just take the pill for that PCOS and liver dysfunction, and I'll be healthy. And then you take it, and yes, on paper, you improve some of the markers, but you don't lose any weight. You don't really feel any better, and you just improved artificially some of those markers. That's what we're doing with cholesterol right now. People take medications to lower their cholesterol. To what end? You still got the inflammation. You still got all the other reasons why you got the high cholesterol to begin with. And yet you think lowering it artificially with a drug is making you healthier. Whereas you could do the same thing and actually get healthy just by switching to real food, which is a finding they found here in this study. The menstrual cycle in 2 groups was all significantly reduced after 12 weeks. The ketogenic diet participants' menstrual cycle returned to normal by 4 weeks. How many of you ladies would love to have normalized cycles? I don't know any woman who enjoys bad cramps on their time of the month. It sucks from what I hear. I can't speak firsthand, but I've been around enough women in my life that I know that TOM is a bitch sometimes. And so I want to go kick Tom in the nuts for you ladies and let him know he's not welcome here. But 4 weeks on keto and it got better. The possible reason was that oral contraceptives were contraindicated in the participants with abnormal liver function. For women with liver dysfunction and PCOS, oral contraceptive was given after liver function returned to normal. Therefore, the menstrual recovery time in the control group was longer than that of the ketogenic diet group in women who had the PCOS and liver dysfunction who were obese. ALT and AST were the key enzymes in the biological processes and had been used as markers of liver function. So remember, the main point of this study was to look at those two markers and how they improved. Reports had showed that their levels elevated in different liver injuries, hepatitis, cirrhosis, either induced by alcohol, viruses, drugs, or oxidative stress. In our study, we found that the ketogenic diet significantly reduced the ALT and the AST compared with control group after 12 weeks. This was consistent with other studies which showed that a very low-calorie ketogenic diet would decrease AST and ALT in people with obesity and mild kidney failure. Growing evidence shows that the prevalence of non-alcoholic fatty liver disease in patients with PCOS was significantly increased, and PCOS may actually be one of the risk factors for developing non-alcoholic fatty liver disease. Guys, this is why it's so important. Once you develop a chronic disease like PCOS that's related to insulin resistance, you are more susceptible to more diseases. It's just like autoimmune disease. Once you get one autoimmune disease, you get a ton of autoimmune diseases. You just have that propensity. And same with this. Once you get one disease related to insulin resistance, you get a bunch of diseases related to insulin resistance, unless you heal the underlying insulin resistance. About 40 to 50% of patients with PCOS had hepatic steatosis on the imaging. In the present study, we found 100%, 10 out of 10 patients with PCOS had fatty liver in the control group, and 87%, 7 out of the 8, in the ketogenic diet group. After 12 weeks of intervention, the signs of fatty liver disease disappeared in 6 out of the 7 in the keto group, 1 out of the 10 in the control group. These results indicate that the ketogenic diet has the additional benefit of improving liver function, treating fatty liver disease, compared with the traditional drug approach for women. All right, so let's get to the limitations that they say about their study. First, it was a trial of, as a pilot study. So as such, a pilot study is a very small study sample, which has certain limitations when you try to apply it clinically. So if you're a clinician and you're hearing about this pilot study, this doesn't mean you need to necessarily jump to go put all of your PCOS, liver dysfunction, obese women on a ketogenic diet. If you want to try it, it's certainly not bad as an option, because this definitely proves the concept, but it's not enough to say verifiably anyway, at least from a research standpoint. So that's a limitation. Secondly, other comparative studies were needed to determine whether these effects were due to the dietary approach or the weight loss. They always do this in studies, by the way. And I've even heard, if you want to improve your diabetes, just lose weight. And of course, that assumes it's the weight loss that provides the benefit. But I've always contended, no, it's not the weight loss necessarily that provides the most benefit. There's probably some benefit that comes from that, but it's the dietary change that provides the benefit. And they're saying in here, we don't know. Is it the dietary change or is it the weight loss? Future studies with an appropriate sample size should be conducted to investigate the effect of keto to see if it's the keto diet. How would you, I guess you would induce weight loss in a way other than keto. So maybe they do in the future studies with the bigger group, one study group just on the ketogenic diet, just as they did in this study, but then another study group on kind of a low calorie, low fat diet that's high in carbs, and then compare the two groups. I guess because then they would lose weight on the low fat, but would they see all the same improvements in the liver function and the PCOS? That would be really interesting. In addition to improving the menstrual cycle, the ketogenic diet had the additional benefits of reducing blood glucose and body weight, improving liver function, and treating fatty liver compared to drug therapy. Therefore, we conclude a ketogenic diet may be considered as a valuable non-pharmacological treatment for women with PCOS and liver dysfunction who were obese. So guys, that's the study. There were no conflicts of interest declared. It was funded by the Beijing Hospital Authority Ascent Plan over in China. So really, really fascinating study, you guys. Go look it up. I'm going to give you the title of it again. Ketogenic Diet in Women with Polycystic Ovary Syndrome and Liver Dysfunction Who Are Obese, a randomized open-label parallel group controlled pilot trial. It came out January 2021, and it's in the Journal of Obstetrician, I can't say that word, and Gynecological RES 2021. So here it is. Japan Society of Obstetrics, I can't say that stupid word. OBSTETRICS, obstetrics. I think I got it that time. And gynecology. All right, I want to see what you guys have to say about this one. We're going to come here first to Instagram, then over to Facebook, finally over to Twitch. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. Girl Cooks Primal, many parallels with PCOS and endometriosis. Although I was not obese, I had 4 major surgeries before 26 years old. At 28, I decided to go keto. I was able to come off of pain meds and hormones and got pregnant at 29. That is awesome. And it's a shame because all through those surgeries, you probably never heard anything from your doctors about nutrition, about the effects of diet on those various hormones that would affect your health. Joshua says, I find being fat adapted makes traveling easier. It just gives us the ability to not eat to my advantage. Yeah, like if it's a short flight, and I consider less than 4 hours a short flight. And that includes going to the airport, going through all the everything, a 4-hour flight, and then going through the airport, going all everything before you can get to food. Anybody that's fat adapted can easily travel like that. So I don't know why those 2 dropped out of the study just because of business travel, unable to do keto. Doesn't make a lot of sense. But again, they didn't start keto until they did this trial. That's the other thing. I would have loved to have seen maybe if they were going to do a keto diet, maybe a run-up. Because remember, they did it for 12 weeks, which means the first 2 to 4 weeks was the adaptation period. And remember, by 4 weeks, the fatty liver in the keto diet group got better. All of their fatty liver got better by that point. I eat 2,000 calories a day, says Becky. Yes. Yeah, I think for women, I think 1,600 to 1,800 as a bare minimum when it comes to calories. I think guys, about 2,000 to 2,200 as the bare minimum. Now, again, it's going to vary from person to person. If you're a teeny tiny little lady or little guy, or man, short man, small man, maybe you don't need that much. I don't know. But it just seems to me when you go below 1,500, you're just asking for the body to go in a bit of starvation mode of, all right, you're not really feeding me properly. I was debilitated with pain from endometriosis until around 6 months on keto. Periods got lighter and less painful. I would love to see the comparison between keto and low fat. Yeah, I hope they do when they do the follow-up study, trying to do, now that they proved the concept in a smaller study, and again, that's called a pilot study, now go do it in several hundred people and randomize, double-blind, placebo, all the things they did in this one. Joshua says, how come other countries seem to be doing the best studies right now? Yeah, this one's out of China. And we see a bunch out of Australia, New Zealand, the UK. But yeah, America, the NIH has shown no big interest in wanting to research ketogenic diets. Whereas the rest of the world, this is the hottest topic in nutritional health, is what are all the applications for a ketogenic diet? And when we wrote Keto Clarity, in the back of the book, I talked about all of these conditions that we know a ketogenic diet is great for. Things that we have strong evidence for, things that we have emerging evidence. So here we go. Solid evidence for a ketogenic diet. We talked about epilepsy. We talked about type 2 diabetes, weight loss, cardiovascular and other metabolic syndrome, PCOS was in there. In fact, here's what we wrote about PCOS. It's a common hormonal disorder, affects women of reproductive age, major cause of infertility. A clinical study on PCOS and the ketogenic diet was conducted by Dr. Eric Westman and others in a medical journal, Nutrition and Metabolism, in 2005. 5 women with PCOS went on a low-carb, high-fat ketogenic diet for 6 months. And these women had an average weight loss of 12% of their body weight, as well as improving all of their hormonal measurements. 2 of the 5 women got pregnant during the study where they had experienced infertility before. So we had that in the Keto Clarity book. We also had non-alcoholic fatty liver disease in that same section. We talked about fat in the liver does not come from dietary fat, but from carbs. The liver turns carbs into fat called triglycerides. So this is another reason why you eat keto, to lower triglycerides, which is the bad fat. So when you have bad fat in the blood, it's going to have to get filtered somewhere. And where it gets filtered is through the liver. Well, when that bad fat, triglycerides, goes through the liver, guess what that liver does? It grows and it becomes fatty. This is why corn high carbs are used to fatten up pigs. In a study published in September of 2006 in Digestive Diseases and Sciences, 10 healthy volunteers experienced fat loss in the liver after they went on a low-carb diet for just 10 days. Another clinical study by Dr. Westman in February of 2007 in that same journal also looked at 5 patients with non-alcoholic fatty liver disease. They were put on keto for 6 months. The 4 people who followed the instructions given by the researchers found weight loss, resolved their fatty liver according to a follow-up biopsy. Even the severe scarring called fibrosis that accompanies this non-alcoholic fatty liver disease will improve on a ketogenic diet. So guys, we talked about this. I wrote this book in 2013 and it's still relevant today. We still have lots of research like this paper I read to you today. So no, it's not new, but it's good to see it's still being looked at, still trying to be corroborated. Dawn says, so true, I have PCOS, psoriasis, psoriatic arthritis, and Hashimoto's. I've been able to lose 75 pounds with low-carb keto. It's taken 2 years, but it is slowly coming off. Well, keep at it, Dawn. You're doing great. I'm sure just like a lot of people who have recovered from conditions eating keto, we feel we lost a lot of years of our lives. You are correct. No one talked to me about nutrition. No, they don't. But see, here's the thing. Now you have had your eyes open. Now you know better. Go share it. Guys, this is why I come on Jimmy Rants every single day. I'm just one guy, but I am like screaming from the mountaintops all the information that I learned about. Everything I learn, I'm distilling out to you guys because I want you to learn and I want you to pass it on. Don't sit idly with this information and just assume, well, they'll find out eventually. Well, it'll trickle down to doctors eventually, and maybe they'll start telling their patients eventually. You've got friends, you've got family, you've got people you care about in your life. Go tell them. Go tell them. All right, thank you, Instagram. Let's pop over here now to Facebook, see what you guys have to say. Holy crap, look at all those comments. All right, my daughter has PCOS, says Sherilyn. Sorry to hear that. I hope this information helps today. Stephanie says, I'm convinced I had undiagnosed PCOS since I was a teen. I had many of the symptoms, irregular periods, cystic acne, higher body fat despite being active, liver problems, hypoglycemia, on and on and on. I was told that it was just what I had to deal with. I was on a high level of birth control for years, trying to control the hormones. All of these symptoms were resolved with keto. That's amazing. Thank you for sharing that, Stephanie. Sorry I couldn't read all of that. You wrote me a novel, so I tried to get the gist of what you said. Crystal says, I have the NutriSense CGM and BioSense breath ketone meter. Awesome. we'll keep testing to see how you're doing. Tanya says, have you heard anything about FitTrack scale, how accurate that one is? I've heard they're not so accurate, and the best is DEXA scan, but I already got the FitTrack. Yeah, I'm not familiar with FitTrack. DEXA scan, is that a scale? I know you can get a DEXA scan, and that's not a scale. You lay on a table and it does a scan. But TANATA, T-A-N-A-T-A, is the gold standard that I've heard from many of the doctors and researchers I've talked to. I have to travel all the time, and I have absolutely no problem doing keto. Fasting is the choice when you really have no good choices. Exactly. Let's see here. Wow, I'm getting spammed big time. Somebody got on here and said, oh, we're going to spam Jimmy Moore in the middle of his show. Thank you for letting me know. A few of my followers are like, you've been spammed. Yes, when I'm deep in the throes of doing my show, I'm not looking at the comments as they're coming in, and I have like 20 comments in a row that's all this spammer decided to go to town. I wonder if keto will fix that. No, probably not. Carol says, I'm confused. Dr. Westman said we won't feel hungry eating keto. Eat until comfortably full. What if we don't eat 1,500 calories? I suppose if I don't eat enough, I risk overeating the next day. Carol, great question, by the way. So one of my friends on Instagram is Rebecca Farmer. So if you guys don't follow Rebecca, Tailored Keto Health is her username. She's overcome amazing disease that had her not balloon up in weight, but she was like down to 70 pounds as an adult woman. And she went on kind of a carnivore diet. After dabbling in keto, she went full bore carnivore. She was able to heal herself. But one of the things that she does now is she listens carefully to her body. And if she's not hungry, she just doesn't eat. And so what you're saying is, okay, look, there's some days I don't feel enough to eat 1,500, even to 1,500 calories. And so on those days, okay, fast. If your body's telling you, I'm good right now, it's all good. And then the next day, if you feel hunger, then start to eat then, and you're probably going to eat an adequate amount of calories. I think we get caught up in this mistaken notion that we need to be eating every day, that we need to be making sure we have meal times, and we just need to be listening to our body. Eating more intuitively is always going to serve you a lot better than trying to force food just because it's that time of day that you normally eat. So if you're finding that you're not hungry enough to eat, then maybe skip that day and don't eat at all. And then the next day, you'll be ready to eat and probably eat a whole lot more than 2,000 calories the next day. That's perfectly fine. I think that's very natural. And you won't do that every day. It's not like you're going to fast a day, eat a day, fast a day, eat. It's not going to turn out that way. But don't fall into the trap of thinking, oh, well, I have to eat because I have to have food. If I don't eat, well, no, don't play those games with yourself. If you're not hungry, don't eat. If you're hungry, do eat, but eat enough. And the way you can get your calories up there is to make sure you're eating adequate amounts of fat. Very easily can you get to the 1,600 to 1,800 calorie minimum by making sure you're eating adequate fat. All right, thank you guys for those questions over on Facebook. Let's pop over here now to Twitch. Pretty light today. Hope someone looks at menopause and keto. Yeah, Cariana, there have been a few studies out there that looks at menopausal women. And yeah, I mean, I would love to see more studies along that line as well. I think that is an underserved community, because there are a lot of women, and of course they beat themselves up because once you are postmenopausal and you're in the throes of that, it creates issues that make things challenging. But again, keto normalizes hormonal health. So it stands to reason. I don't need a study to tell me that if someone's in menopause and they're trying to balance their hormones, keto has already been shown to work in spades to help balance your hormones. So it makes sense that it would be beneficial. Don't wait for a study, Cariana, but certainly if a study of that kind comes around, Jimmy Moore is going to be bringing it to you here on Jimmy Rants. All right, guys, so I hope you enjoyed that study. Please share the word all about this study with anyone concerned about PCOS and about liver dysfunction and who have obesity. Keto is showing efficacy, and we need to celebrate that. And that's it for this episode of Jimmy Rants. JimmyRants.com is the website. As always, come join us live over on the Jimmy Rants Instagram page. It's right here. We go live Monday through Friday, 11 a.m. Eastern Time. Thank you so much for being here today. We also simulcast over on the Facebook page as well as on Twitch. Just a reminder, download Twitch, follow Jimmy Moore Rants. Twitch is an app that you can find on your phone. You can watch the replay right here on the IGTV on Jimmy Rants Instagram page. It's also over on Twitch, it's on YouTube, and it's on JimmyRants.com. Again, today is Jimmy Rants on Livin' La Vida Low Carb Show Day. So we usually run on my flagship podcast on Tuesdays, the best of Jimmy Rants. And so recently I've been doing a whole bunch of episodes all about the jab in the arm. And so go check out today's episode, llvlc.com, or wherever you listen to podcasts. So coming up tomorrow on Jimmy Rants, I've got an article that a friend of mine sent me about carbohydrate deficiency and how you avoid carbohydrate deficiency. We're going to have so much fun with that one tomorrow. So be sure to come back here 11 a.m. Eastern Time on Wednesday, and we'll see you then.